We have not finished the day, so now our third stop is for surveillance. And surveillance, and I like the idea of facilitating and the bridge. And we, you know, during the third joint action, my kids were younger, and when people ask them, what is mom is doing? She built bridges. So that makes sense, and you will see with the next stop on surveillance that they will make a lot of bridges between the different ecosystems and the human, animals, and environment. This is really One Health. So surveillance is our radar. From patient to cattle, from pets to rivers, we need to know where resistance is and how it spreads. So only then we can see the full pictures and act before it's too late. Surveillance does not mean just generating data. It means trust, transparency, and early warnings to trigger targeted actions. So today, several national networks contribute to European AMR monitoring, linking hospital, farms, and even wastewaters. So to see that, please welcome our experts presenting these latest findings in surveillance. So I call first on stage Sofia Ny and Lucie Collineau. Thank you very much.
Thank you so much, Marie-Cécile, and welcome to this last session of the day that's going to be all about getting Europe ready for One Health surveillance. So there's a bunch of us here today that's going to help us get through this session, task leaders that's going to talk about what we've been doing during the last year, and also a bit about our successes, about our challenges, but also about what we plan for the coming years. So, but before we are also going to have two parts of this presentation where you can ask questions. So we are really keen to hear your opinions and your questions, so please use this opportunity. And but yeah, before we get into all the details, we want to take just a minute to step a bit back and look at our work from a broader perspective, because we have all heard the terms One Health surveillance and integrated One Health surveillance, especially in the context of AMR. But what do those terms actually mean? And the truth is that they can mean different things for different people. So that's why, let's see if... yeah? Okay, but anyways, we took some time during the fall to develop a joint vision of what integrated surveillance means to us. And we want to share that with you today. So I can see it like changing here, but yeah. Anyways, I'm just gonna shit back. So we envision an approach for Europe where selected AMR surveillance data from human, okay, perfect, animal and environmental sectors are analyzed and interpreted together when and where it adds value to strengthen evidence-based decision-making and policy, for understanding risk, guiding interventions, and protecting health. We believe that this approach preserves and develops the quality and purpose of each sector's individual surveillance. So we are not here suggesting to put all our data, all our surveillance system into one ginormous system, but instead to have preserved the quality and the scope of each sector's surveillance and analyze the data together when we think it adds value. And then, of course, the next question becomes, how do we work towards this vision? Well, we believe it to be our mission to improve the usability, quality, and the scope of each sector's surveillance. And we do this by making more data available for integrated analysis. And we are establishing and expanding 2 new European surveillance networks, EARSVET and EARS-ON, that you will hear more about. so we're adding to this picture. We are also mapping current human, environmental, and One Health surveillance efforts in Europe to identify gaps and opportunities for improvement. We are developing and improving national One Health surveillance reports. So we are really trying to look at all the different aspects and the data and improve the data that can lead us to a really excellent One Health analysis. So now we are going to get into the details, and to help guide us through that work, I welcome Amy to the stage. Amy is a task leader for strengthening AMR surveillance in the human sector.
Thanks, Sofia.
Great.
How's it going?
Have you here? Last year in Bilbao, we heard a lot about that you were going to make an inventory about microbiological surveillance and then present the results in a dashboard. So can you just talk us through how is that work going, and where are you with that?
Yeah, thanks. So 2025 was a really great year for us. We did build our inventory. We finalized our survey and sent it out to all 30 participating JAMRAI countries. We were really thrilled to get 28 responses back. It was more than I think we were all expecting. So thank you if you're in the room and you answered our survey. The content of this survey was really our inventory. And what we had decided early on was that we were going to put our inventory into a dashboard. And we did this because we asked about 1 million questions in our survey. And the questions were really, really complex. So we thought a lot about how the best way to visualize this. So we set up our test dashboard. It was live on the EU-JAMRAI website as of June, but we didn't really promote it. It was really just kind of for our partners to give us feedback, and the national coordinators who answered to give us feedback. We also shared it with stakeholders to see kind of what they would like us to fix and edit. So a lot of great feedback went into our very first official version, which was launched officially last week on the EU-JAMRAI website. And without further ado, if you haven't already seen, I present JAMRAI. It's a dashboard of national AMR surveillance in Europe, and I hope you also find the logo and the name very fitting. So thank you to the communications team as well for helping us with this, Victor, because this is just it was so great.
Great. I can see that the dashboard is definitely alive and well. So what was your thinking when developing this dashboard? What was the aim, and what information can you find in it?
So like I said, it was really our aim to put the inventory of AMR surveillance systems in Europe into a dashboard so people can use it. It's interactive by nature. It was designed with the idea to facilitate improvement and development of microbiological surveillance of AMR in Europe at the national level. And as well, it's also designed for data-driven decision-making and development. It's very easy to use with a little bit of help, but with a little bit of practice. But it can be used by both AMR experts and policymakers. To give you a little snapshot, if you haven't already gone into the dashboard, this is kind of one example of a question. You have on the left filters, so you can filter by country, culture, material, pathogen, and resistance. And then on the top, it might have got cut off, but it's the 3 different sections. That was also how we built the survey. So you have national surveillance, national genomic surveillance, and then I just can't read. But yeah, you have an idea of what I mean. You have 2 different tabs for viewing. So you have the visuals tab that we're looking at now. So it's a bit more nice to look at, but as well, if you want the table view, you have it as well. So yeah. Does that answer your question?
Yeah, for sure. But I can also say, like, it's a lot of data, I can imagine. And but then a lot of data on AMR. So what is then the difference between EARSnet, for
Yeah.
example, and JAMRAI?
Okay, so we're just focusing on surveillance systems. So we want to know what makes surveillance systems, how we are harmonized in Europe, but also the main difference is EARSnet is showing actual AMR data, and we are showing how the systems are set up. So for example, the question we have here is looking at mandatory versus voluntary or no surveillance for carbapenem-resistant Klebsiella from urine samples. So you really get an idea that it's more about how systems are set up. So what we have visualized is data coming from 28 countries, 5 culture materials, 8 bacterial priority pathogens, and 12 resistances. And again, it's live on the EU-JAMRAI website, so it's really easy to find. Feel free to take a look.
Perfect. So then if I'm sitting here and I'm a partner, or really anyone working with national AMR surveillance, how would you suggest, how can I go about using this dashboard and starting to look at all the data that's in there?
Yeah, so as I said, it's easy to use when you get the hang of it, but we have come up with a little schematic for you to start with. So the first step is to explore. It takes some time to kind of get into it. If you haven't seen the survey, if you haven't seen the questions, go in, play with the filters, see what's there, read the questions, but also read the response options and kind of see how other countries are doing, which leads to the next part, compare, which is not always a nice thing, but I think it's really important in this case. You can compare with neighboring countries, you can compare with countries of similar resources or size, or you can compare, Luxembourg can compare Sweden, however you see fit. From this, you would then go on to ask the question, what are the most urgent priorities that you need on your list, so that you can act. And as well, it's important to note that you should reach out to the consortium. I think there's 120 partners. It's a huge opportunity to take action with the dashboard.
Great, so then maybe you can start filtering your favorite pathogen. Yeah. So if you're really into carbapenem-resistant Acinetobacter baumannii,
you got it.
You can find it there and see.
It's all there.
Perfect. Okay. So what are then your plans for the future? Are you done now, or?
We're not done. We still got 2 years left. So we have a lot of, we're still going to have ongoing development of the dashboard and the inventory. So I started with the inventory. It became very clear early on that a kind of evolutionary approach to the data that we had collected is really important, especially over the course of the JAMRAI timeline, to see kind of what is being changed at different national levels. But we also had feedback from partners on how some of the questions were not inclusive, or they didn't really work, or how things were phrased. So this is something we're actively working on. The dashboard itself will get a kind of not a makeover, but we'll have a few improvements. So we are currently developing an Insights tab, which is kind of more adapted for national EU policymakers, as well, to kind of see how the data looks. It's a bit more analytical, and how the dashboard relates for implementation of EU Council recommendations. In addition to this, we have a scientific publication that our teams are working on. This is really the idea to promote the results that we got with inventory, as well to promote action and to promote the use of the dashboard. We have capacity strengthening coming up. This is led by our subtask leaders at SSI and DTU. So please keep an eye out for all of these fun things.
Great. So a lot of things planned, but what if, looking a little bit back at the last year, but also forward, what would you say is your biggest challenge with this work?
Yeah, so the next 2 years of JAMRAI, we're really focusing on the partners' implementation journey, so using the dashboard to make some actions in each country. Why this is a challenge for us is that we have spent the first 2 years focusing on the products and getting these things out so people can use them, but they're not done and they still need to be maintained. So for the next years, we'll be wearing 2 hats, which I think is going to be a lot of work, but I'm really confident that between our teams, so we can make it happen.
Yeah, and it's also, I mean, it's going to be a really interesting shift, it sounds like, and also to hear more about, from partners, what is going on in every country and so on. So you were also saying something about the implementation of the EU Council recommendation, and I mean, that's everyone's favorite policy document. So
I brought it. I printed it and brought it with me.
Yeah. So if anyone needs it, we have it. But so how would you say that that JAMRAI supports and follows the implementation of the EU Council recommendation? Can you give some examples?
Yeah. So in the context of what we do with surveillance, we have looked at the Council recommendations, and we have 3 indicators that we're very much so focused on when it comes to the inventory that we have in the dashboard, how we promote it. So the first is the push towards mandatory surveillance for pathogens resistant to last line treatments. We have many questions asking about mandatory versus voluntary surveillance, and it's also a tool for countries to think about making the shift from voluntary to mandatory. The second is the available data that is existing in certain countries away from culture materials like blood and CSF into something like urine. So if we wanted to launch an expansion of AMR surveillance, this is very interesting for us. And then the last is the use of AMR surveillance data for designing national treatment guidance for common infections. So again, going back to kind of patient care and using data appropriately. We have this analysis with us. It's not in our slides for today because of time, but Sofia and I will both be at the networking corners tomorrow morning and tomorrow at lunch, so please feel free to come ask us about this, and please check out the dashboard. Happy.
Thank you. Thank you so much. Hand over to our colleagues, Lucie and Peter, to take us through the next part.
Thank you. Thank you very much. Okay, so for the second part of this session, Peter Damborg and myself, Lucie Collineau, will give you an update about ESVET, the European AMR Surveillance Network in Veterinary Medicine that we are co-leading. So maybe, Peter, before we start, we should maybe remind our audience here that there is some surveillance of AMR in healthy animals at slaughter already, which has been coordinated by EFSA over more than 15 years now. So maybe to start, could you please remind us what ESVET is about, why do we need ESVET, and how ESVET is going to complement the existing surveillance of AMR in animals?
Yes, sure. Many questions. I will try to address them. So let me see. I don't know if you can see them up here, but anyway, what I'm trying to show here is a figure of JAGRA, from JAGRA, the report showing the current surveillance landscape of AMR and AMC in the EU. And I don't know if, can we get it up here? Yeah, there we are. And you can see here we have surveillance of antimicrobial consumption in animals from ESURVET, antimicrobial consumption in humans from ESACnet, and then we have surveillance of AMR in deceased humans from the ESNet, of course. And then, as you mentioned, Lucie, we also have for the healthy animals, but something is missing. We don't have from the deceased animals. And also, you can say, we don't have for our companion animals. So the current healthy animal AMR surveillance is for the food-producing animals, but we don't have any data from our pets. So you can say, why do we need this? And I've listed here multiple reasons why we need AMR data from from clinical isolates in animals. And I'm a veterinarian, so I would say the main reason is for the sake of the animals, for the health of the animals. And you could argue, if we have such surveillance, then you can say, well, if we have a problem arising, AMR emerging, then we can do something about it. We'll find out about the problem. We can establish an intervention. Such data on AMR could support any policy making. It could also support development of antimicrobial treatment guidelines. And then there could be this intervention afterwards. Again, this AMR surveillance could then show if it worked or not. And now I mentioned the veterinary part, but of course there's also a human aspect, because a lot of the pathogens that we want to look at AMR in, they are zoonotic pathogens, and the resistance mechanisms are also zoonotic. So it's actually both for the benefit of animals and humans.
Okay, thanks a lot for emphasizing this. So in JAMRAI 2, we didn't start from scratch because ISVET was already launched during JAMRAI 1, which built the foundation for this network. In JAMRAI 1, we defined the vision, the objectives that were presented just before. We also identified a preliminary scope of bacteria we could look at with some standards, and we also conducted a pilot study. So in JAMRAI 2, we built from all the work we had done in JAMRAI 1 to move one step forward and have a second phase of development of ISVET. So maybe, Peter, could you please explain briefly the progress we have achieved for the past 2 years as part of JAMRAI 2?
Yes, you can say one of the main differences is the size of ISVET, sorry. And you can see here, this is the scale. You can see we have 19 countries as opposed to only 9 countries in JAMRAI 1. And we have 40 partners involved as opposed to only 11 partners earlier. So it has really expanded quite a lot. Then if we look at the scope of ISVET, so I don't expect you to read all this, but this is the combination of the animals on the left, the animal species for which we look at AMR in clinical isolates. Then you see the infection, and then you see the different bacterial species we look at AMR, or we intend to look at AMR in. So we've added a few animal species. We've added horses, we've added sheep and goats, and then you can see with the red lines some bacterial species we have added as well. And then we have omitted turkeys because we thought the data source was not sufficient. Another thing we have focused on in the beginning here is what we can call harmonization activities. So we have made an ISVET manual, and this manual is actually explaining everything we're doing from the data source, the quality of the data we should get, and how to analyze it, etc. So something, we call it a living document we can update over time. In relation to that, we have an interpretation expert group because interpreting data can actually be quite complex. We intend to interpret using ECOFs, but sometimes we don't have ECOFs, so we need an alternative strategy. And then we have developed MIC plates, customized MIC plates for proficiency testing, so to sort of ensure or validate the labs, sort of quality control, but potentially also for future diagnostics to have the same susceptibility plates being used in different countries as opposed to now where it's a mixture of each country's own plates and methods.
Okay, thanks for this. So I understand you are gathering quite a lot of different data from different sources. So could you explain us what are your main challenges so far and how you are planning to address them?
Yes, and I can see I actually skipped a slide, but anyway, I can also mention this before I go to the challenges. Just to mention a few things that we also did in the last year. We have made a data sharing agreement, so getting ready to get data. We have prepared with different software to get very diverse types of data into a common format, so it'll be easier to interpret. And then we have actually launched a call last year for data, antimicrobial resistance data, from 2016 to 2024, and that call is closed, and we are now in the phase of analysis. But let's move on to the challenges. Of course, one main challenge we see is sustainability of ISVET, because right now it's part of JAMRAI, which is fine, but JAMRAI ends at some point, and we heard about this sustainability issue before. And it's definitely something we need to look into, because it's nice to look at AMR in this period I just told you, but what about after that? What about after the interventions and so on? I don't think it's worth a whole lot if we cannot look ahead and see what happens once we change policies, once we add treatment guidelines and so on. So this is really something we need to look into. And then we also have about data availability, type, interpretation, and so on, various issues, because the data sources, the data types we're getting, they're so diverse. So it's a lot to hold on to. But as sorry? Oh, sorry, it's not loud enough, sorry. So yeah, we've started quite ambitious. We have a lot of animals, a lot of bacteria, a lot of antibiotics. We want to really include as much as possible, and then we'll see how far we get and what makes sense in terms of the analysis, and then we take it from there.
Okay, so could you briefly explain what are your plans for the second half of JAMRAI then?
Yes. So yeah, we are analyzing now the data, as you know, and once we have the data analysis ready, we'll make a report, ESVET report. We say right now third quarter of this year. So hopefully next year you will see the results with trends of AMR in different pathogens in different animals. We also have ongoing whole genome sequencing. We've sequenced, I think, 500 isolates, and we're adding sequencing data from different labs. And to look at, you can see here on the slide which combinations of bacteria and resistance we're looking at. And also to show the zoonotic relevance, because some of these we may see similarities between what we have in animals and what we see in humans. And then we're also looking into making a dashboard. So we'll have some, you can say, easier, something nice online dashboard where you can actually easier find what you're interested, which antimicrobial resistance you're interested in. Yes, and then the last slide here is just to show we have a lot of ongoing collaboration. You can see the different partners here. We are sharing our expertise. We're gaining expertise from some of these partners, and also feedback on how to interpret data, which, as I mentioned before, can be a bit tricky.
Perfect. Thank you very much, Peter, and thank you all for listening. So if you haven't done so yet, we invite you to look at our website, which has been made available by the communication team. And of course, we are happy to take any questions, either during this meeting or also later by email. Thank you. To continue this session, so we'll have a panel discussion about the first two presentations that were made. So I will invite Sofia and Amy to please come back on the stage. And then, if you agree, we'll open the floor for discussion from the audience, either here on site or online. So we need to squeeze in the middle, is that correct?
Perfect.
Okay.
Okay. Yes.
Thank you for really, really exciting presentations. Very, very interesting. Sorry, you're supposed to go more center, Lucie. I was curious for EARS-VET. Has that been used for any kind of outbreak research across countries yet? Or is that an aim that it might facilitate looking at outbreaks?
Yeah, please.
Yeah, maybe I can respond and you can add, Peter, if you want. I don't think it has been used for outbreak investigation so far, because I think we are collecting retrospective data from, so in this case, the first data call was from 2016 till 2024. But we have now a huge network of partners that have access to those data, that have access not only to the EPI data, so the results from antimicrobial susceptibility testing, but also potentially that have access to the strains themselves, that we could potentially request, sequence, and maybe, investigate those outbreaks further. So it's definitely something I think that we could consider as well. Do you agree, Peter?
Yes.
Okay.
Hi. Yep. Thank you very much for the presentation, colleagues, for both. My question is on EARS-VET. First of all, we are looking forward as Commission to the report and the analysis of that data. I think that can give us some tangible information that it could be useful for us. And my question is more technical. I'm just curious. when you presented this Excel table with types of infections, I have two questions about it. First of all, how or why did you choose this particular type of infections? And why in dog and cats you didn't include any digestive infection? Because it seems quite logical as a potential zoonotic infection for humans.
Well, yeah, I can answer. So we had a discussion in the group about the scope, because the scope was actually defined at the beginning of JAMRAI 2, and then we sort of threw it up in the air at the first meeting we had in Paris, and discussed what data do we have and what data do we have sufficient amounts of, what would make sense to include. So it was sort of a joint decision, consensus-based decision on which combinations of animals and bacteria we should include. Some people said that we've included too many combinations that is difficult to get an overview of, and we might have sometimes we will get data where we only have 2 countries to compare. And this is how it is, because you can say we are, in a way, we are more ambitious than ESNet, because we have more combinations, right? But yeah, about the digestive pathogens, I don't think we discussed that really, did we, Lucie?
Like the scope is not limited in terms of infection types, so we are limiting on a combination of animal species and bacteria. But for now, we ask the partners to send information either on the type of samples or the type of infection, because some have one or the other or both. And then we'll, from these, present the results in the most relevant way, depending on how well the type of infection is being informed. So that's the way we're addressing things. That said, the scope is not set in stone. We're learning by doing. This is the first really large data call we're doing. So depending on data availability, also how the epidemiology of AMR is evolving, it's something we can adjust in the future. So that's flexible, I would say.
Okay, I have the micro already. My name is Tim Eckmans from the National Public Health Institute in Germany, the Robert Koch Institute. Thank you very much for the presentation. For the second, for the ears wet, I'm very much involved from the countryside in EarsNet, and my recommendation is not to make it too complicated, because we are running very good with a very easy system, and it's good if most of the countries or all the countries can join. And if there are only 2 countries, then it's questionable. I have one question for you. How much of the antibiotics are given to companion animals and how much to livestock animals? Do you know this comparison? Because I often ask the people and they don't know, and I don't know. It's probably much less than 10%, or do you know how much it is? Antibiotics are given to livestock animals, and perhaps it's different. In Europe, do we have one number for Europe, or? And I have another question to the dashboard, but perhaps first this.
Yeah, I'm not sure, to be honest. I know. Sorry? 4%.
4%.
Okay.
So in terms of volumes, it's much smaller. Depends a bit how you count it. Is it doses or volume, as always? But yeah, it's smaller in companion animals than in livestock. However, at least for France, I can say that while there's been a lot of progress on reducing antibiotic use in livestock, it's really not the case in companion animal, where the use is rather flat or almost sometimes increasing. So it's like, okay, maybe the volume is smaller, but I think it's still of interest that, companion animals are also part of the overall picture. Thank you.
Yeah, and maybe I can add, at least from a Danish perspective, that, one thing is the volume, but it's also the types of antibiotics being used. I know that fluoroquinolones and third generation cephalosporins, companion animals in Denmark account for more than 50% of total use in animals, even though we produce 30 million pigs per year and many chicken and so on. So it's not just the the amount, but it's also there's also a difference in the types of antibiotics. In general, more broad-spectrum antibiotics are used, at least in Denmark, and I assume in many other countries, for companion animals.
But I think the risk is that the point of view is moved from livestock to companion, but I think the bigger problem is in livestock and antibiotic use in livestock. But I'm not sure. I think something like this is perhaps not so complicated to get this data. The other, for the dashboard, I wonder what is the sustainability concept for the dashboard? Because of course something it should be go to the ECDC, because at the ECDC we have great dashboards and all the things, and on this website we are for looking for numbers, and now to have another dashboard elsewhere, I don't know who will look at this, because we will look at the ECDC dashboard. Thank you.
First of all, I think that the information in EARSnet and in the JAMRAI dashboard are very complementary. It's not the same. And it also includes like information on more culture materials. So it's more about like looking at what do we need to work on in order to have a better surveillance in Europe. And regarding the sustainability, thanks, I think that's a really interesting question and something we think about a lot, of course. But we are also trying like not to get ahead of ourselves, because in order to have sustainability, we have to create a product that is actually useful, because there's no point in getting all stressed about sustainability before we have a product that people are happy with, that people are using. And we are doing really what we can with, it's completely open source. We are sharing the code, it's very easy to copy, and it's quite low maintenance to sort of host, and it doesn't cost us anything. So we are also trying to just develop it in a way so that it would be easy to sort of, for someone to take over, or for someone else to keep running, or for us to keep running. So that's the answer right now. Thanks.
Yeah, maybe last question.
Oh, I also have a mic.
Sorry, I can't see.
I'm here. Hi, Roosmarijn from the Netherlands. Congratulations on the dashboard. Maybe to help also share this story with my colleagues, could you describe a few real-life work situations where you foresee for a policy officer or researcher, okay, this is the time where this dashboard is useful for you, so we can make it a bit more practical. When do I open this?
No, but there's a few, like the best examples I think is the ones highlighted in the end, connected to mandatory surveillance or expansion of surveillance. And it could be then, for example, if you're interested in where are your country when it comes to notifiable surveillance of AMR pathogens, how do you compare to other countries, if that's an interest? And then you could open the dashboard and pick a pathogen, for instance, carbapenem-resistant Klebsiella, because we've been talking about that. Then you could instantly see which countries already have mandatory surveillance of this pathogen from blood, from urine, from lower respiratory tract infections, and then get a baseline for so these are the countries that have this. It's in the council recommendation that this is something that we should achieve. And you can see which countries have voluntary and which countries are lacking the surveillance. And then you could like go through your favorite pathogens and just get like a picture and see, okay, so our country is ahead on this, but we really need to move forward on this other aspect. And there's a lot of more examples, but this is, I think, a way where you could start exploring if you're a surveillance person.
Can we take last question from Diamantis, and we really need to hurry up. Okay?
Thank you. I will be very quick. Thank you very much. I think it was, and I think it will be useful, especially now we're looking in expanding to other samples. So the question there is, I think. If you have foreseen expanding a bit and including attributes like degree of automation of the data, coverage, or representativeness, because I think this will be very helpful if someone is considering how to, expand in other samples in addition, on top of, for example, blood cultures, because then I think with blood cultures we are quite used to them, but with other samples there are, I think that the scope gets much broader.
Yeah.
Thank you.
So it's a really great point. It's there. So we have population coverage and geographical representativeness. And so if, for example, we wanted to think about expansion out of blood and into something, or to expand and include urine, we can already see the countries that say they have a very high 75 to 100% coverage of data for this. So it's already there. For automation, it's definitely something we can think about adding into the questionnaire that we send out.
There is a question on real-time systems, which countries have them in place, and also a lot of things relating to patient data, national guidance. So it's, yeah, come and visit us.
We will show you everything.
In the corner we can show.
Okay.
I'm here.
Okay.
We'll take that.
I'll give it.
After this, we'll open a moving company, right?
To start the next session, the environment, which has been mentioned. Sorry. We're going to move on to the third sector, the environment. Can we maybe have a slide first? My name is Heike Schmitt. I'm from the National Institute of Public Health and the Environment in the Netherlands, and we're doing this together with...
Yeah, my name is Roosmarijn Luiken. So, Heike, I joined JAMRAI 6 months after the start, and you were there in the beginning, designed this work package together with Christophe Dagot. Why? Why do we need to address AMR in the environment, AMR surveillance?
Yeah, actually when we designed this, it was obvious that there were very little continuous governmental-driven surveillance efforts in the environment, and there was also very little guidance on how to do so. And on the other hand, what we know is that the environment can act as a transmission route when antimicrobial resistant bacteria or resistance genes are introduced with human wastewater or animal waste, and humans are exposed, for example, through recreation. The environment could also act as a source of emerging mechanisms of resistance. But actually, what we don't know is the extent of this transmission. So in the way, the environment is actually the black dot because we don't know everything about its full role.
Yeah, so indeed, and that's why we started designing core elements for a common approach of environmental surveillance of AMR.
And did that actually mean that we then went to choose targets, like we heard, for example, ESBL-resistant E. coli?
No, and that question has been asked a lot, what targets? But we say we first need to have the objective clear. Surveillance can have several objectives. So we need to talk about what is the objective. And to complicate things, the environment is not one thing, of course. There's many compartments, groundwater, surface water, soil, and there's many subcompartments. So we say we need to have this couple and we need to prioritize this couple, which compartment with which objective. If we know that, we can talk about the characteristics of a target that fits this objective. And if we know that, we can talk about the targets.
So actually you mean we have to take a step back and first define objectives and compartments, and then we can choose the appropriate indicators.
Yes. We already heard about complicated questionnaires, also from our work package. There was last year going around long questionnaires. Heike, can you share some results out of these questionnaires?
Yes, of course. And if you want to know more, then also we will show some results in the dashboard that is also not yet published and finalized. But what we saw when we asked countries whether they have existing activities in AMR surveillance, actually quite a number of countries had these activities. And what we can see is that mainly these were directed at wastewater and also surface water. But what we also know that the approaches taken are quite diverse, and at least we have something to start with.
But does that mean that actually the countries already have environmental surveillance in place?
Actually, not from a governmental perspective. So still it held true that there are very few governmental driven surveillance activities indeed.
So this means there's a need for setting some and prioritizing jointly some core elements of a common approach.
Indeed, and that is also why we continued with our approaches. We also continued with running a second questionnaire, now directed at experts defining their ideal future system of environmental surveillance. And here we see some answers of experts where we see that actually some combinations of compartments and objectives of surveillance were chosen by many of them, among them to provide information about patterns and trends in AMR in, for example, wastewater and surface waters. So actually, and what we also did, we used our own group to perform prioritization exercises where we went to similar exercises. So we had 3 pieces of information, existing studies, future ideas, and our own work to come up with a common approach. And actually, we would like to show you this approach here, and I would invite you to do so.
Yes, I will make a start. So here we present some of the core elements of our first common approach for environmental AMR surveillance in Europe. We want to emphasize that this, what we present, these results, is a prioritization out of those many options we had in objectives, in compartments, in targets that exist in environmental surveillance. As often we cannot do it all, and that's why we deemed it necessary to prioritize. And we hope that these priorities can serve as an advice for member states initializing environmental surveillance. If you want to start, where could you begin? Our first priority is surveillance in surface water, with the most prioritized objective to collect data to feed into human risk assessment. For example, by determining concentrations to which humans are exposed to while recreating in water. The second prioritized objective is to collect data on AMR trends in the environment. And the most prioritized targets fitting these objectives were third generation resistant cephalosporin resistant E. coli and a panel of relevant resistance genes. And this is our first priority and our first advice in this common approach that we have written. The second priority described is raw wastewater. But Heike, I have always learned wastewater is not part of the environment. Can you explain?
Yes, indeed. Wastewater has a special status within the environmental arena, let's say, because actually if you use it, if you think it can be used to derive information about carriers of AMR in the human population, then it's not really a truly environmental compartment. On the other hand, it's recently become very important due to the recast of the Urban Wastewater Treatment Directive, which foresees a mandatory surveillance of AMR in wastewater, with the goal to generate more information, more knowledge on the roles of treatment plants and the environment. It's also addressed in another joint action project, EU-WISH, which is devoted to wastewater surveillance in its entirety. And we also observed that there's actually quite an overlap between the experts working on environmental surveillance and the ones working on wastewater surveillance of AMR. So actually what we did, we joined forces to come up with our prioritized approach towards wastewater surveillance of AMR between these 2 joint actions.
Interesting. So what are the priorities set for wastewater?
For raw wastewater, untreated wastewater, the prioritized objectives were to indeed determine trends of AMR, but then in the human population, in the human community, and also detect emerging forms of AMR, use that as a kind of sentinel for emergence. The targets, therefore, were also slightly different. Carbapenemase producing Enterobacterales are the target by culture, and also metagenomic analysis were mentioned much more often than for the environment, but also experts foresee in monitoring of certain genes. Yeah, so this is our first start of a common strategy. Does that actually mean our work is finished within JAMRAI? Is that our deliverable and we are going to stop here?
No. Surprise. No. This document, we believe, is a great start. But it's also a living document. It's in development. And one of the things we're going to do to optimize these advices is start a pilot. And we are really happy that within JAMRAI we can start a pilot on environmental and wastewater surveillance. So in this pilot we will test parts of this common approach. We will sample surface water, wastewater, measuring ESBL and CPE. And by doing this, also one of the aims is that we hope that we build capacity and awareness and knowledge within the labs and the countries of the member states within our group. Going back to my first question, why are we doing this? Heike, can you share something? Do you believe that a pilot will be valuable for reaching our goals?
Yes, definitely. Of course, it's a pilot, so it will not generate as much information as we would ideally like to generate, but still we think it will generate information that will help comparing countries with respect to their exposure of humans through recreation, for example, and with respect to trends in wastewater. But also the process itself might be important because undergoing such a process will also help engaging with other stakeholders in other domains.
Yes, indeed. We also hope that a pilot in our member states will be a conversation starter. As we already heard, sometimes the conversation with the environmental domain can be difficult of where to start. So we also hope that this pilot can be a conversation starter. And in the last 2 years, we tried to put some effort, a lot of effort in the collaboration and conversation with the other One Health domains, because for the environmental domain, it's not possible to do without. And we will keep continuing doing this.
And this is also what we'd like to end with, just mentioning that this is a totally collaborative exercise. This was based on a common approach of all of us, which is nice, and we are really keen to reach out to you and hear your opinions and your inputs, and looking forward to further collaborating with our co-task leaders and JAMRAI. And actually without JAMRAI, exactly this large collaboration would not have been possible, reaching out to so many countries. So that's one of the great assets of this network. Thank you.
Thank you.
Thanks a lot, ladies, for this update on environmental surveillance. And so for the next part of this session, which will be the fourth one, I'm welcoming Moira Kelly. Thanks, Moira, for being with us. Moira works at Sciensano, and we're coordinating an activity to integrate the surveillance data together. So we heard about surveillance in human, animal, and the environment, but how are these surveillance data getting together? That's what we'll try to explain a little bit in this session. So thanks, Moira, for being with us. In the last General Assembly last year, you explained that an important step to building One Health surveillance of AMR was to identify your One Health network, your programs and actors. So what have you learned so far about the surveillance landscape in participating countries?
Yeah, thank you. So I think the main take-home message is maybe not that surprising. The situation is really different in different countries. So I'm going to show you in the next couple of slides data from the 17 countries that completed this exercise. And here, for example, we can see coverage. So along the top, we've divided the data by sector, and there's subsectors on the bottom. And the color of the square shows the type of data. So if there's a colored square, that means that there is at least one surveillance program collecting that type of data in that subsector. And you can see that it varies quite a lot. There are some columns where there is data collected in every single country, and the vast majority of these are outlined in red. And those are the countries where it's mandatory, the subsectors where it's mandatory by European legislation to have surveillance. But when we look at coverage in general, I think, as you might guess from our previous subtask leads, the coverage is most full within the human sector. We see more gaps in the animal sector, especially in companion animals, and then in the environment, that's really where we see this most variation between different countries. But of course, it's not just, is there at least one surveillance program collecting data? What the surveillance landscape can look very different. So here we're looking at the number of programs. And the first bar, for example, the first bar is a program collecting resistance data in the human sector. And the length of the bar indicates the number of programs. So in some countries, we have one program where all of the data on AMR, whatever the setting within humans, is collected in one place. And in other countries, we have 30 different programs that are all collecting data. And of course, just a key point, this does not mean more programs, does not mean a better surveillance system or more data or more coverage, but it does have really important implications. Our main goal is to support countries in developing these One Health networks and reports, and that task is going to look very different if you have 5 surveillance programs in total in your country or if you have 50. So the most important thing is that each country has an overview of who is collecting data, what type of data. We also looked at some of the characteristics of these surveillance programs. So for example, whether they're mandatory or voluntary, if they're on a national or subnational level, whether they're for resistance data an active or passive monitoring system. Most importantly, is the data open access? Because of course we want to bring this data together in a One Health report, so that's important to know. If they already have whole genome sequencing data, and also if they report to a supranational system. So in all of these things, we see quite a lot of variation. In some countries, for example, all of the systems, the only systems active are those that are reporting to a supranational system, and in others that actually only represents a very small proportion, they have a lot of additional national level surveillance programs. So yeah, variation, that's the key message.
Okay. So considering there is so much variation from one country to the next, what are you doing in JAMRAI to try to harmonize the way One Health reporting of AMR is being implemented?
Yeah, so one of the things we're currently finalizing at the moment is we're trying to select a small number of indicators that are really One Health indicators, which countries can report data from at least 2 sectors relating to resistance and consumption data. And this was really actually a task that came to us as a request from the participants to really collectively prioritize where we see this additional value that Sofia was talking about of joint analysis and reporting. So we're supporting countries in prioritizing, but a nice secondary bonus is that if we're all using the same metrics, we'll be able to get this overview across participating countries and other countries that maybe follow our recommendations. Most importantly, we're trying to align these with other international efforts. We don't want this to be an additional burden for countries. And of course, they need to be useful. So we're selecting indicators of political, social, and intersectoral relevance, and that are feasible for countries to collect with their current systems that are in place.
Okay. So beyond those One Health indicators and realizing that countries are at different stages of developing their One Health report, right? Some have One Health report for years already, some have nothing, are just starting. So how can you collectively, identify areas for improvement that you can build upon and hopefully improve during JAMRAI 2?
Yeah, so of course we have meetings and we talk and we see where we're all finding problems or where things that are already developed in one country and not so developed in another. But to try to sort of formalize this, we asked countries to also do a One Healthness assessment using a tool called the One Health EpiCap tool. This is actually a tool developed in a previous European project in the European Joint Partnership One Health Matrix. And our main objective here really is that this is a tool that performs a semi-quantitative assessment in terms of the organization, operation, and impact of a One Health surveillance system. But really what it does is it allows you to bring together all of these different actors from the different sectors and to have sort of a structured discussion where you analyze your weaknesses and strengths, and you can prioritize your activities. So what comes out of it is a list of your priorities of what next steps you can take to build your capacity in terms of One Health, which I think sometimes can be quite a difficult roadmap to map. But it has, again, a nice secondary objective, which because we've all used the same tool, we all have these same scores. Together we can look at this data and say, okay, where do we see that all countries are actually finding this a bit hard? And when we look at the data, what we see is that in most countries, the highest scores are in operations. So actually a lot of countries already have some form of One Health network, in some cases already a report, where they are sharing knowledge, they are communicating between sectors. But actually they score lower on the organization, so especially the formalization, the documentation. In some cases, the roles aren't shared very well between different sectors, and especially in terms of dedicated resources for One Health surveillance. And then the lowest scores we see are in impact. like you say, a lot of countries are very early on in this process. A lot of countries either have no report yet or they have had their first ever One Health report within the last 18 months. So of course, you can't expect things to be impactful from the very beginning. And it's also quite hard to assess impact, especially using a very general tool for a specific problem. So in some ways, it's not surprising that those were the lowest scores, but it's still useful for us to know. But it definitely highlighted some common strengths. So like I said, actually a lot of countries have really effective intersectoral communication, and this was really highlighted as a strength. And the nice thing about it was that lots of countries said that their most positive impact was the collaborative additional value that comes from having this effective communication and knowledge sharing between sectors. We certainly saw some common weaknesses, especially between like the sharing of methods and data between sectors, integrated analysis, having dedicated resources just for One Health surveillance. In most cases, people are doing this as like an additional activity on top of their main surveillance program. And like I said, in terms of external impact.
Okay, so building on those common weaknesses that you have identified, what's your plan for the next 2 years? How are you planning to facilitate capacity building?
So because we do have countries that are in really different stages, we have decided to sort of split our work up into 4 different groups. And we've identified 4 priorities that were all shared by a group of countries. So we're going to have 4 working groups. The first one is really about establishing a One Health network and report. So those countries that are really in the early stages, hopefully they can learn from each other to help set their priorities and their goals for this report. But also we can bring in some of the countries that, like you say, have much more established reports. And hopefully by learning from each other, we can streamline, that establishing stage. We're also going to have a group about developing integrated analysis, where hopefully we'll support countries in performing national-level JACRA-like analyses. A lot of countries, I think you've heard a lot about dashboards. Dashboards seem to be very popular, and a lot of countries wanted to have a way to be able to share their data in a really interactive way, particularly with policymakers. So we have a working group where we're going to write a template for a simple interactive dashboard for AMR and AMC data, and also organize trainings for the national coordinators within each country so that this dashboard can really be implemented on a national level. And then our last working group is about One Health whole genome sequencing surveillance, which is really about understanding the enablers and the barriers, so where people are and where different countries are in terms of incorporating whole genome sequencing. And from our first discussions, we really see that actually those barriers may be less on the technical side and more on the data sharing side. And so I think one of the key sort of goals for that group is to develop recommendations that can hopefully really support national level policy level discussions, because of course, the policy varies per country and the data sharing agreements will really vary per country. And so we want to be able to support that within the JACRA framework.
Okay, excellent. I think that closes this session. So thanks everybody for listening, and then we'll open the second panel discussion, where I will invite again a colleague from environmental surveillance to come here on the stage so we can take your questions. Thank you. So is there any question on environmental surveillance or cross-sectoral surveillance? Either here on site or online? We can't see you, so please just shout out and we'll listen.
Yeah, thank you. This is Ricardo Carapeto. I work in the Spanish Medicine Agency. It's a question for the last presenter about integrated analysis. And you were mentioning the JACRA report, and how were you thinking to do it with environmental surveillance to integrate in the analysis? If you are trying to develop a methodology by yourself, or to do something in conjunction with the JACRA, or I don't know. Thank you.
Yeah, thank you. I can answer. Maybe Moira can add as well. I guess maybe some of you are aware already, but I think there's a plan for the next European JACRA to include some environmental surveillance data. So hopefully that will inspire also the work we are doing. Well, obviously, we know we work also across tasks. So we are looking closely at the progress being done in the environmental surveillance to align the indicators that we want to include into One Health surveillance reports. From the mapping which has been done, I mean, the AMR data available now is quite limited, but you know, there's a lot of capacity building being done, including a pilot that will come soon that will generate those data, and want to make sure that this data can be integrated into those One Health surveillance reports. So whenever they're ready, we are happy to include these. And obviously we're talking to each other to sort of align the indicators that are relevant to the different sectors. Yeah, do you want to add?
Yeah, maybe to add to this, obviously some approaches of the JAMRAI reports don't work for the environment because there's no deliberate use of antimicrobials apart from very rare occasions, maybe, in fruits trees. So the general approach of linking usage to resistance doesn't work. And also we have to acknowledge that actually many of the bacteria we find in the environment come from humans and animals. It's not a reservoir in itself, often for many of the species we look at. So actually we have to think how to include that in JAMRAI wisely, and maybe we need also additional approaches where we more look at human exposure estimates rather than trying to link the phenotypes or genotypes or resistance levels across the different reservoirs. So a challenge.
Mm-hmm. And maybe if I can stress just something, we're not, like our goal in cross-sectoral surveillance is not to perform JAMRAI analysis at the European level. I mean, there's an interagency working group working on this. Our role is to facilitate and implement cross-sectoral surveillance at national level. So we're trying to learn from countries who have been, you know, progressing on this to inspire others and hopefully improve collectively, so that hopefully by the end of JAMRAI, each participating country can have a One Health surveillance report with relevant indicators to be included.
Here, Ernesto Liebana from EFSA. Just to thank you very much for the excellent updates that you have all given. I wanted to clarify on JAMRAI and the environmental part. The expectations are perhaps too high. JAMRAI 5 is coming at the end of this year, and all we are doing is involving the European Environmental Agency in our discussions. They are members of the working group with the idea to discuss some of the things that Heike has highlighted right now, that not all the correlation analysis that we are doing are relevant, but also the type of data that we collect is very different, and we are seeing more and more that the surveillance in the environmental compartment is going more towards molecular methods, towards things which are not directly comparable with the type of data that we collect now. The idea is that perhaps there will be a JAMRAI 6, probably quite different to what JAMRAI 5 is, because we are also having to make this report more sharp, easier, and less complex, and we may home into some of these individual, let's say, directions of comparisons in that diagrams you have seen, where perhaps only one of the comparisons will be relevant for the environment, and we will try to bring that type of data in this JAMRAI 6, which will come in 2 or 3 years' time. Yeah, thank you.
Thank you so much. I think this is a really fascinating area. I was wondering about environmental surveillance, because you mentioned for wastewater, especially as one of the objectives to monitor antimicrobial resistance in the human population. How do you foresee this to be quantitative or only qualitative? And then, if it would be quantitative, do we know enough about how to quantify, for example, the genetic, the resistome in the wastewater? Thank you.
Yeah, very interesting question. First of all, can it be quantitative? Yes, it can be quantitative. And what we advocate is actually not only using genetic elements, which also can be quantified, but also really taking indicators that are directly comparable to human and animal surveillance, that is culturable, for example, carbapenem-resistant Enterobacterales, and these can be quantified indeed, because I think one of the most important applications would indeed be to identify trends in time, and then you have to quantify for sure, yes. There was...
Thank you very much. I was just curious about the pilot for the environment, if you will be working with the European Commission to regarding the Urban Wastewater Directive. So will your pilot inform the implementation of the Urban Wastewater Directive?
Now here we are at a close shave because the wastewater directive moves at an incredibly quick time frame. So the implementation guideline will probably have to be ready this summer. This is exactly when we start our pilot. So I think we will just for timing not be able to provide the full results. On the other hand, also what we have been hearing about the UWVTD implementation is that the actual monitoring only takes place starting in 2028, and probably it also will require regular updates as it is such a new area. So we are definite that we can feed into this process at one or the other stage, and we have already done so. So we have already contributed with the first results of WISH and JAMRAI to the stage as it is now, and we will continue to do so.
Yeah, just to add on that, in WISH we did a similar prioritization exercise, but then just for wastewater, raw wastewater, treated wastewater. And this was done a bit in advance of what we are now doing in JAMRAI. So that was done last year and was for at least the member states in those groups in good timing to really get things going on in their own country, to think about these targets and comment on the recommendations that are going around. Yeah.
It may be nice to say that some of the decisions and discussions we had actually made it into the country comments. So we are sure that we are feeding into that process.
I think it's time for one last question, if there is one.
If there is time, I may take the opportunity to ask for a question I couldn't ask in the previous one, and it's about ERSVET. And I think it's about the sustainability. I think we all realize that one of the, as it has been presented now also, there's a lot of difference in uptaking of surveillance programs, whether they are voluntary or they are mandated by law. And I think one of the challenges is that there is no legal instrument for implementing surveillance in veterinary pathogens. So my question is, after all these fact-finding and conversations you had with different member states, what is your feeling about the likelihood of such a system running on voluntary basis for a number of years? How many countries will be willing to collect data, report data, and contribute to an European-wide report, similar to what was done with SBAC, for example, at the beginning, that for many years was voluntary, and it was an incremental number of countries. What is your feeling about that? Thank you.
Yeah, thanks. It's a very good question. Thank you. Well, I think we have to show the value, right? So that's really what we're working on right now. We're working very hard to try to make the process easy. That's one step, and then hopefully the results interesting and relevant for those contributing. Whether we should make it mandatory or not, I think it's quite hard, right, to make it mandatory. I can maybe share the experience from France, where we have been running the RESAPAT network, which is about surveillance of AMR and animal pathogen, and this has been running for more than 40 years now, voluntarily. It's not mandatory in France, because the labs, those providing the data, they see the value. They have a lot of support, technical support on how to do antimicrobial susceptibility testing, for example. We train them, we organized interlaboratory quality assessment, and they come a lot for that, to get that support on how to do AST testing in animal pathogens correctly. So, they get something out of it. It's not only, a big machine with a lot of burden of work to send the data. All of this, we know, takes time. But, the other way around, they also get something out of it. And, having this technical support on AST testing, for example, is a big added value for them. So, building on the experience from some countries, France, but also others, we have been doing this for several years on a voluntary basis. We are hoping that we can convince more countries that this is important, we can do it and try to make it easy and hopefully useful for those countries. Thanks. Before we finish this session, I just wanted to share a few concluding remarks to close this session. So back to our initial mission, which was phrased by Sofia, for our surveillance activities in JAMRAI, the ultimate goal is to improve the usability, quality and scope of each sector surveillance, and ultimately to put this together into an integrated One Health surveillance. You have heard a lot of ongoing activities, and I can say proudly that we have made quite big achievements during the first half of JAMRAI. There was a lot of mapping activities. You heard about JAMRAI in the human sector, but also mapping in the environment and also across sector. So mapping is a tough exercise, takes time, but I think it's useful for each country to know where they are, what are the data providers, and where are the gaps. So we can build on this mapping to learn from most advanced countries and hopefully improve towards harmonization. So we proposed key indicators, for example, for surveillance in the environment or cross sectors. We also proposed harmonized AST panels and interpretation criteria, and also developed our first ESVET manual. And we also have improved towards joint data analysis since we closed our first ESVET data call. So that was an important milestone achieved a couple of months ago. So for the future plans, the second half of JAMRAI 2 will really be dedicated to implementation. We heard there will be pilot testing for environmental surveillance. We heard about capacity building activities with different workshops, for example, on how to build your national interactive dashboard, or you do your sort of JACA-like integrated analysis. And obviously, we'll also publish our first ESVET and ESONF reports. And last but not least, we want to start now thinking about sustainability beyond JAMRAI 2. That was mentioned several times, not only for the tools that are being developed, but also for the networks that we have started creating. So how you can help? Well, there's quite a large audience here with different roles. We think that for competent authorities, we would like to make you make sure that we would like you to make sure that One Health surveillance of AMU and AMR is a priority of your national action plan, and also to make use or good use of your JAMRAI budget. We are currently underspending in JAMRAI 2, so there is time, there is budget, and there is resources, so we have to go for it, really. For national agencies and affiliated entities, please do engage into national implementation. Work package and task leaders, we're here to facilitate the process, but we need partners to engage and really take ownership of what is being done. So it's not sufficient to you do your mapping and your questionnaire and then, yeah, I'm done. No, it's actually you take the results of your questionnaire and your mapping, and you learn your gaps and you build on them to implement and hopefully improve by the end of JAMRAI. So ownership really we think is critical for the success of JAMRAI 2, and it's really a call here to move towards ownership. And for external stakeholders, so let's talk about synergies with JAMRAI surveillance activities. We are very happy to collaborate. And as mentioned already several times, we think your support will be key to sustain our work. So we are very happy to talk about this during this General Assembly, and especially during the stakeholder forum organized on Friday morning. Thank you very much for listening.